Here's a question almost nobody asks after a checkup. What did it not test? Blood pressure, a blood draw, a scale. Everything looks normal. That's the routine, not the full list. Quick note before we count down. This is education, not a diagnosis. General guidelines, USPSTF, CDC, not personal advice. Ask your own doctor. These 10 tests are recommended for most adults over 40. None of them are automatic. You have to ask. Some get skipped by about a third, others by 4 and 5. Let's count down to the most forgotten. Number 10, the bone density scan, or DEXA. It's generally intended to detect osteoporosis, bone thinning before a fracture happens. Guidelines call for it in women 65 and up, or earlier with risk factors like early menopause. National survey data shows about a third of women over 65 have never had one. The catch: men get almost no formal guideline for it at all, despite real fracture risk of their own. Number 9, colorectal cancer screening, a colonoscopy, or an at-home stool test. It's intended to catch precancerous polyps or early cancer, often before any symptoms exist. The recommended starting age recently dropped from 50 to 45, and yet CDC data shows roughly a third of eligible adults still aren't up to date. The catch: a lot of people over 40 simply haven't heard the start age changed. Number 8, depression screening, a short questionnaire, not a blood draw. It's meant to catch a treatable condition before it becomes a crisis. Guidelines now say every adult should be screened at every visit. But the research behind that guideline found that without a formal tool, more than half of depression cases in primary care go unrecognized. The catch: if the doctor doesn't hand you the form, it often just doesn't happen. Number 7, a comprehensive eye exam for glaucoma. It's intended to catch pressure damage to the optic nerve early, while it's still symptomless. Ophthalmologists recommend a baseline exam at 40, then regularly after. It's nicknamed the silent thief of sight for a reason. Roughly half the Americans who have it don't know yet. The catch: by the time you notice vision loss, it's already permanent. Number 6, an HIV test. It's intended to detect infection early, when treatment works best and transmission risk drops sharply. The CDC recommends it at least once for every adult 13 to 64 as routine care, not just for perceived risk groups. Even so, national survey data shows roughly 2/3 of adults have never been tested. The catch: most people over 40 assume this test is for someone else. Number 5, a full-body skin exam. Intended to catch melanoma and other skin cancers early, when they're most treatable. Dermatology groups recommend annual checks for anyone with real risk factors: fair skin, a lot of moles, family history, years of sun exposure. And still, surveys show about 3 in 4 high-risk adults have never had a professional one. The catch: most people only think to check the spots they can already see. Number 4, a hearing test. It's meant to catch hearing loss early, before it reshapes how you talk, work, and stay social. There's no blanket guideline pushing everyone to get one, but hearing health groups suggest a baseline around 50. Even so, roughly 4 out of 5 adults over 50 say their own doctor hasn't asked about their hearing in years. The catch: hearing loss creeps in so slowly, most people adjust to it instead of testing for it. Number 3, a blood sugar test for prediabetes and type 2 diabetes. It's intended to catch rising blood sugar years before diagnosis, while it's still reversible. Guidelines call for it in adults 35 to 70 who are overweight every 3 years. But the CDC estimates more than 80% of the 90+ million American adults with prediabetes don't know they have it. The catch: if your weight looks normal, the standard guideline may not even flag you for it. Number 2, low-dose CT lung cancer screening. It's intended to catch lung cancer at an early, more treatable stage in people with a real smoking history. Guidelines cover adults 50 to 80 with a heavy pack year history who currently smoke or quit recently. And still, recent data shows barely 1 in 5 eligible people have ever been screened. The catch: Most eligible patients say, no one has ever brought it up. And number one, the most commonly forgotten test on this list, hepatitis C. It's intended to catch a liver infection that can sit silently for decades before causing real damage, and it's curable in most cases now. The guideline could not be simpler. Every adult 18 to 79 screened once, no risk factors required. And yet recent data suggests over 80% of eligible adults have still never been screened. The catch, because it asks nothing of you, no symptoms, no risk category. Almost nobody thinks to request it. So here's the full list, from bone density at roughly a third skipped, up to hepatitis C at over 4 in 5. Notice the pattern. The tests that get skipped most aren't rare or expensive. They're just not automatic. Here's the real takeaway. A normal checkup is a floor, not a ceiling. It covers the basics. It was never designed to cover everything you might need at 40, 50, or 60. So bring a list. Ask which of these apply to you at your age with your history. None of this replaces your own doctor's judgment. That's the whole reason to ask. If you want part 2, I'll cover the tests doctors say people under 40 skip just as often. Subscribe so you don't miss it.